Great. All right, I'll turn it over to Senator.
Well, good morning to everyone, and thank you so much for joining this call today. This is really important. Right now in Washington State, 1.8 million people are covered on their health care through Medicaid. But right now in Washington, D.C., House Republicans just voted for $880 billion in cuts directed at Medicaid. For reference, that is more than all of federal Medicaid spending in 2023. Cutting that deep comes with its own cost, one paid for by Washington State families. Hospitals will close their doors as this funding drops. Moms and babies will lose healthcare coverage. They'll wonder how to get postpartum care or to pay for a checkup if their sick child desperately needs it. Seniors will be cut off from homeless care services and forced out of long-term care facilities. Families in our rural communities will have to travel further than ever for healthcare. Children and teens who need life-saving mental health care will suffer. People with disabilities and caregivers will be cut off from support they need. Emergency response times will skyrocket from closures, which cost precious time as the nearest ER gets further away, and crowding as patients put off preventive care they can no longer afford until it causes problems that they can no longer ignore. Republicans need to stop listening to Donald Trump and Elon Musk, who want tax breaks for their billionaire buddies, and start listening to their constituents who just want to stay on their health care. Because if they did, maybe they would realize Medicaid is a lifeline for people in red and blue communities alike. In fact, 70% of people who voted for Trump said cuts to Medicaid would be unacceptable. Right here in Washington State, the two districts with the most people covered through Medicaid and CHIP are both represented by Republicans. And yet House Republicans are charging ahead with cutting Medicaid by $880 billion in order to give tax breaks to billionaires. How are they ever going to explain that to folks back home? Here's another question to consider. How many billionaires are there in the 4th Congressional District? How many billionaires are there in the 5th District? Well, that's a genuine question, and I want you to know I looked, and the best I can tell, it's pretty much next to none. But you want to know how many people in the 4th District are on Medicaid? 250,000 people in the 4th District. Know how many people in the 5th District are on Medicaid? 200,000 people. 1 in 5 people in Washington State are covered by Medicaid, including 3 in 8 people with disabilities, 3 in 5 seniors, and nearly half of our children. Are Republicans really going to shut Washington State families out of a doctor's office so they can roll out the red carpet for billionaires? Well, the good news is we still have a long road ahead before the final passage of these devastating cuts. And at every step of that road, I'm going to do everything I can to protect healthcare for our families. I'll be lifting up the voices of families in Washington State. Every voice and every story will matter. Every phone call, every letter will make a difference. So I'm going to be making sure that at the very least, our Republican House colleagues hear from the constituents they are hurting. And I'm really proud today to be joined by constituents of mine from the 4th and 5th districts to hear from them. So with that, I'm going to turn it over to start with to Aaron, who can speak about this. So Aaron, thank you for being here with us today.
Great. Good morning. My name is Aaron Wilson. I'm the CEO of Chaz Health, and I'd like to acknowledge the Senator's concern about the catastrophic impact that Medicaid cuts would have for our rural and urban communities across Eastern Washington. Chaz Health is a federally qualified health center based in Spokane, serving both urban and rural populations in Eastern Washington and North Central Idaho from 26 physical clinic locations. Chaz Health provides comprehensive medical, dental, behavioral health, and pharmacy services to patients of all ages, as well as wraparound services to address the social drivers of health needs of patients, reducing barriers to care, and improving health and wellness by investing in preventative behaviors. Community health centers collectively improve access to essential healthcare services in both isolated rural and densely populated urban areas. We also integrate services such as behavioral health, substance use disorder treatment, dental care, and pharmacy. Community health centers rely on Medicaid to sustain our healthcare operations. We are one of 28 community health centers across the state of Washington. At Chaz Health, we serve 108,000 patients in the state of Washington, 53% of whom are covered by Medicaid. That's nearly 60,000 Washington Medicaid enrollees who depend on Chaz Health for their full array of primary healthcare services. For perspective on the volumes of care that are at risk, over the past 12 months, Chaz Health has provided more than 300,000 visits for Washington Medicaid patients, including over 180,000 medical encounters, over 80,000 dental encounters, over 36,000 behavioral health encounters, over 8,500 clinical pharmacy encounters, and filled over 400,000 prescriptions. In our service area, cutting Medicaid would leave the nearly 60,000 patients we served this last year without any healthcare coverage, and includes many working families and small business employees that are otherwise unable to afford health insurance. In addition to providing essential care for patients, Chaz Health is a major employer in the Spokane region with more than 1,900 employees and living wage jobs. This creates tremendous economic impact to the community. As I noted earlier, Medicaid is a key financial component to community health center operations. Again, if Medicaid is cut, there's not a scenario where health systems don't end up eliminating critical life-saving services and programs as a result of the financial repercussions it would cause. Medicaid cuts would be devastating to the more than 230,000 people living in both urban and rural communities of Eastern Washington who would no longer have access to healthcare services they need. Dismantling this critical program would mean that patients no longer have access to regular preventative health care, to manage chronic disease, to access crucial prescriptions, or to receive mental, behavioral, and oral health services. Medicaid coverage ensures that our family members and neighbors receive the essential services they need to live healthy and fulfilling lives. The stakes have never been higher, and we must act now to protect the future of healthcare for our communities and vulnerable populations. I'd now like to hand it over to Julia Barcott for comments. Thank you.
Thank you, Aaron. I'm Julia Barcott. I'm an ICU nurse, 30 plus years now in the Yakima County. And I'd like to talk a little bit about the impact on Yakima and my patients and coworkers, as well as the hospitals, nursing homes, everything else. In Toppenish, 69% of our patient population is on Medicaid. We see about 23 inpatients a day and more than 300 daily come through our hospital and ER. Unfortunately, we saw the devastation that not having healthcare coverage caused during COVID. We had a number of patients who had very significant illnesses, chronic illnesses, didn't come in because they had no healthcare. So when they finally came, they were very, very sick, but they only came back after they were able to go back to work and get their insurance reinstated. So we're getting more younger and more diverse in the area that I serve. We only have one large hospital up in Yakima and two rural hospitals down in the lower valley, one of which I'm working at. And that's just growing. About 64% are Hispanic, 15% American Indian, Alaska Native. And our particular hospital is on a reservation but serves a diverse population. We also have an inpatient mental health unit, and that is actually doubling because there is such a need for mental health services, and most of those people are also on Medicaid. One thing that nurses and healthcare people know is that people having Medicaid helps increase preventative care so that diagnosis, treatment, medications will make them stable. I'm at a loss to understand, other than billionaires being rich, why you would want to get rid of that, because costs for hospitalization in ERs is much higher than that. So, and I also have heard a lot of rhetoric about that these are just unemployed people that should go out and get a job. A lot of our people, probably at least 60%, are working families that have both adults working in the family and are not offered health care that is affordable through their employment. So I think we are very scared that we are going to have all our hospitals closed. Our one large hospital in Yakima can't deal with the influx right now. And we are getting people from the upper valley coming down to the lower valley for the first time and being admitted. So I just want you all to be aware of the risks of having Medicaid cut. And the people, including your own families, your friends, your neighbors, are the people that are getting that advantage. And we as the taxpayers have a right with our taxes, which pays for a lot of these programs, to be able to have them used to cover Medicaid. Also, children, CHIP, that's part of the Medicaid program as well that could be cut. Preventative vaccines, preventative well child checks, sports exams, the basic stuff for children is also at risk. So is that what we're going to leave our generations with? Is no preventative health care, no ability to take family in when you need to? I'm just extremely alarmed by this, and our ERs are already inundated. People are lying on stretchers in the hall waiting hours to get in. It's only going to make it a lot worse. So thank you for letting me share this with you, because we're all very scared, not only that we won't be able to serve people in our communities, but also we are going to be unemployed and we will have no way to help raise up people who are disenfranchised by this. So I'm going to pass it off to Nellie, and thanks again for listening.
Yvette, if you want to go ahead, that would be great.
Good morning, and thank you, Ms. Murray, for being here this morning, listening to us. My name is Nellie. I live in Sunnyside. I'm also here in the community in Yakima. I'm a home care provider, and I have care for about 15 years. I have been a caregiver. And I also work in the transportation department, which is also funded through Medicaid. It's a medical transportation that we transport people to their medical appointments and to their life-threatening treatments. I'm also very scared because my clients are to the point to where they feel that I'm not just going to show up to take care of them anymore, that there's just going to be that one day when I'm no longer going to be able to go to their homes and provide the care that they have been provided for so many years. And they don't understand the system. They don't understand why this is happening to them. They feel that just because they have already served their community and they're no longer able to be a service, that they feel that they're just being tossed around like they're worthless. And my heart breaks to hear my clients talk like that way, because they don't deserve this. They don't know a lot of what's going on. I talked to them a little bit about me being in a union, and that I do talk to a lot of the you know, that to our congressmen, and they come to me and they feel that I can do something for them. And the only thing that I can do is listen to them and let them know that yes, that I do speak up and I do voice their concerns, because their concerns are also my concerns. Both of the jobs depends on Medicaid funding. And if I don't have a client, I don't have a job. And if I don't, and if these people don't have funding for the transportation appointments, well, there goes my other job, you know. And I might be able to get another job somewhere, but what about our clients? What's going to happen to them? I mean, it's heartbroken to see them like that. To think that they won't be able to get the funding to go to their dialysis, to their cancer treatments, children that I take to Children's Hospital and get their treatments there too. So this is all the people that I serve in my community, and every single one of those people that I hear, it just breaks my heart because they come to me thinking that I'm able to do something. Besides me talking to you and expressing their concerns, I mean, I feel like this is all I can do, and I'm so mad and I'm so upset because those people, they really, I don't understand them. Just because they're not in our situation, I feel that they don't have a heart, that they don't see what they're doing to our community. So I just want to thank you for listening to me. Thank you.
Thank you so much for sharing that. And Yvette?
Thank you, Senator, for having this call and for your leadership in this area. I think the stories that we're hearing are resonating in every state across the nation. This is what the sense that we're getting from your guests are that Medicaid touches every family, each and every family. Whether it's directly someone in your family is enrolled in Medicaid, or you have extended family or friends or clients who are enrolled in Medicaid. It is the nation's largest insurer. It is the single largest payer in the country for behavioral health services. It covers about 1/4 of total spending. It's the primary source of long-term care in the United States. It covers nearly 40% of all children and more than 40% of all births. This is a program that affects us all, and it's an economic driver at both a local, state, and federal level. It's critical to our hospitals and community health centers' ability to provide care. And what we're looking at in terms of the cuts that Republicans have supported is putting healthcare at risk for 72 million people, including the kids, the working adults, the seniors that we've discussed. It will create a $50 billion hole in state budgets annually to pay for these tax breaks for billionaires and corporations, which as a whole states won't be able to recover from. So I think that what we're hearing from your guests is resonating across the country. And there's a lot of fear out there, and we're trying to capture these stories and make sure that they're told universally so that we really understand the impact in full of what the Republicans are proposing here. Thank you for having me.
Thank you, Yvette. And just one last point that I think is really important is this is directly going to impact hundreds of thousands of people who will lose their health care. But our hospitals, our community health centers, our doctors themselves will have to close their doors as well. So even if you're not the one on Medicaid or know someone on Medicaid, your hospital won't be there for them, because this is a critical way that many of these hospitals keep their doors open and doctors are able to provide the care that you need. With that, I think we'll open it up for questions.
Yes. If any reporters on the call would like to ask a question, just use the raise hand feature on Zoom and make sure that your name and are reflected in your title versus the outset. So I'll give folks a second to use the raise hand function if they have questions they'd like to ask. We have plenty of time for a couple questions. Okay, I'm going to go over to Orion. Let's go to the group first.
Thanks, Naomi, and thank you, Senator, and everybody for being on the call here. Senator, I talked yesterday with Congressman Baumgartner about this issue, and something he said was that he wishes Democrats were interested in having substantive conversations about reforming Medicaid, among other things, trying to reduce costs without sort of taking a hatchet to it. I wonder if you could just comment on the climate now with the Trump administration, what that's done to the ability to have those substantive conversations, which of course you've had in the past with Paul Ryan, among others, and whether you would be open to any reforms to Medicaid as it stands now.
All right, thank you for that question. And obviously, over many years, we've talked about ways to make sure that we are efficiently as possible providing healthcare for people in this country. It's taken many turns. But what we are seeing right now has nothing to do with making Medicaid or Medicare or anything else more efficient. It is about cutting it dramatically to make room in the budget for the tax package that goes along with this, benefiting huge corporations and billionaires. So I would say to all of our Republican colleagues, what you are asking is to give somebody a huge tax break, and how you're paying for it is by cutting off healthcare to literally hundreds of thousands of Americans. That is not a conversation we need to engage in. Let's make sure we're providing healthcare for people and making sure that people can get the healthcare they need in all of our communities, especially here in our rural communities that you're hearing from today.
All right, next we'll go to Dave with Keeper.
Hey, good morning. I appreciate you taking my question. My question really has to kind of talk about the communication between both sides of the houses. Obviously, Senator, you're not necessarily in the House that passed this bill, but what's been the communication like between the Senate and the House related to the damage this bill could do or anything like that? And even so, have you spoken to any of the House representatives from Washington State as to the impacts these bills would have? And has that been able to move the needle on some of their ideas on whether or not they want to pass this, or even their ideas of, hey, maybe we should change this bill a little bit?
Well, Dave, thank you for that. And what is going to make a difference for House Republicans who are moving forward very fast with this, and then they will negotiate with the Senate and we'll see the final bill, is for them to listen to their constituents. That is what is going to make a difference right now. Certainly, we are all making the case, but what my plea is for people in those districts to stand up and let their member of Congress know. We have seen in the past when people speak up with a voice, wait a minute, this isn't what I want. I don't want it for my community or my family or for my own job or for the welfare of the nation. That is really what we need right now.
And piggybacking on that, how much of this effort is it going to take for some of these folks to see that the voice of the people, that their constituents are kind of against these things? I've been seeing videos and news articles and stories across the nation where residents are speaking out to their representatives, and the status quo hasn't changed. They're still going down this pathway. So how much effort is it really going to take to change some of these minds?
Dave, I got to remind you, we are only a few weeks into this administration. I can't believe how fast the Republicans in the House and Senate have put together this plan. It seems like they're trying to move it really fast before anybody really understands the consequences, which is exactly why I am doing this today, to have people across the board really understand. Don't let this, jam into us really fast and get it passed really fast before we understand the consequences of it. And when you step back and look at the consequences of these kinds of cuts that they have put into this budget resolution they passed and are now putting together the details of, will hurt every single family in our state and across the nation. For all of those who get their care, whether it's disability, whether it's our senior citizens who are in long-term care, whether it is families who can't get health care, as you heard from some of our speakers, other ways, If they lose their health care, everyone loses their health care. It is that critical.
Alrighty, I appreciate that. Thanks so much, Senator.
And next we'll go to Philip with KGO.
Thank you, Senator, for having this discussion. I do want to just bring my question into based off of comments that came from Congressman Ryan Zinke on CNN yesterday, where the congressman said there is zero mention of cutting Medicaid and saying that if you take a look at Medicaid, Medicare, and Social Security, and you cut out the waste, fraud, and abuse, you can save $1 trillion. How do you respond to that, ma'am?
Well, I would say to him, get real. What their budget resolution did explicitly was direct the Energy and Commerce Committee in the House to find 880 cuts. Why? To provide the room for a tax cut again to the wealthiest Americans. So that direction to that committee to be able to pay for their bill, $880 billion. Give me a break. There is only one way in that committee, and that is to have decimating cuts to Medicaid to provide that kind of resource.
All right, if anyone else would like to ask a question, we do have time for a couple more. Let's use the raise hand function. And since I'm not seeing anyone raise their hand, if anyone's not able to do that, they just let me ask a question, but we can go back to Orion.
Thanks, Naomi. I'd like to hear from not just you, Senator Murray, but anyone on the call if you have thoughts on this. How exactly this would play out is a little bit unclear to me, assuming overall Medicaid spending is reduced coming from the federal government. It would ultimately then be up to states, if I understand correctly, to implement that and decide how to spend those reduced resources. I wonder what you all think that would look like and how it would it would actually affect, for instance, a hospital in Toppenish or in Spokane, a CHAZ clinic in Spokane. And Senator, if you could just maybe you could follow up.
I'm happy to let any of those folks who are in those communities to talk to you about that, right? But I would say this: our state legislature, is my understanding, is already facing deficits, trying to figure out how they're going to balance their budget and get it passed. Adding this burden to them right now, I believe, would be devastating. But I think any one of our folks who are on can answer specifically what they see from their chair.
I'd appreciate it. I guess I would just add for those folks, imagine we're not going to see a 100% cut to Medicaid's funding, but help me understand how, a significant cut nonetheless would affect the work you do.
I just share from a community health center perspective, we're required because of the federal grants that we received to see anybody who walks through our door for services, regardless of ability to pay. And if you pull Medicaid out as, any financial impact of the Medicaid program is going to increase the number of uninsured patients coming to us for services. And the reality is our health systems right now are on a very fine line of being able to survive financially. Reductions in any sort of revenue stream are going to be catastrophic. There's not the ability or flexibility within our system. So that it's going to end up in, hard choices about clinics being open and programs being sustainable. But you'll see those impacts almost immediately.
This is Julia Barcott. I think exactly what Aaron said is correct. And for us, after COVID, we actually had to get a couple of emergency grants to help out because we had lower reimbursement rates, sicker patients. Most of this will actually close at least rural hospitals. And if not the clinics, we have a big farm workers clinic, which sees not just farm workers, but a huge population in the Yakima County and down into Tri-Cities even. Most of their patients are Medicaid as well. We've already had cuts in OB and women's care because of cost issues. So I see this as absolutely being the closure of some of those smaller and rural hospitals. And it's already happening across the nation. So it's just a matter of time till there are no hospitals and services left.
All right. Thank you all.
All
Thank you
right.
again. Thank you again to everyone for participating. And my message to all my constituents in Washington State is now is the time to speak up and let your member of Congress, your senators, know where you stand on this. So thank you.
All right. And since we don't have any other raised hands or questions, we'll go ahead and end the call. Thanks everyone for hopping on. We will distribute this recording widely.
Thank
you.
you.